You just finished an intense workout, feeling that satisfying ache of muscles that have been truly challenged. But then, you notice a bruise, maybe a few. Is this just a normal part of pushing your limits, or have you perhaps gone too far and caused an injury? Well, here is the direct answer. Bruising after exercise is often completely normal and usually not a sign of a serious injury. It is a common occurrence, especially after particularly challenging or new routines, and does not automatically mean you have damaged your body. The reason this happens is primarily due to tiny, microscopic tears in the capillaries, which are the smallest blood vessels in your muscle tissue. When you engage in strenuous physical activity, especially with eccentric movements where the muscle lengthens under tension, these capillaries can rupture. This leakage of a small amount of blood into the surrounding tissue is what causes the visible bruising. Factors like your individual skin tone, how easily you bruise, and even certain medications can influence how noticeable these marks become. So, how can you tell the difference between a normal exercise bruise and something more serious? A mild bruise that appears a day or two after a workout, without significant pain, swelling, or loss of function, is typically nothing to worry about. It might feel a little tender to the touch, but it should not prevent you from moving normally or cause sharp, incapacitating pain. Focus on whether the bruising is isolated or widespread, and if it is accompanied by other concerning symptoms. It is also interesting to note that sometimes tiny red dots known as petechiae can appear, which are even smaller capillary ruptures and usually resolve quickly. Understanding the difference between general muscle soreness, often called delayed onset muscle soreness or DOMS, and actual injury is key. DOMS peaks 24 to 48 hours after exercise and feels like a general muscle ache, whereas an injury often presents with immediate, sharp pain, localized tenderness, or instability. Ultimately, recognizing the typical signs of post-exercise bruising empowers you to train with confidence, understanding that your body is adapting and getting stronger. If, however, your bruising is accompanied by severe or increasing pain, significant swelling, warmth, redness, or if you cannot put weight on a limb or move a joint through its full range of motion, then it is always best to listen to your body and consult with a healthcare professional to rule out a more significant injury. Your body is incredibly resilient, and knowing these distinctions helps you take care of it effectively.